Medical news from MedRxiv. The effect of marital status on suicide risk among patients with breast cancer, a population-based CPTW competing risk analysis. Breast cancer patients who are unmarried are at a higher risk of suicide, with a subdistribution hazard ratio of 1.34, compared to their married counterparts, highlighting the critical role of social support in mitigating psychological distress. This finding is significant because it underscores the importance of addressing the emotional and mental health needs of breast cancer survivors, particularly those without a spouse or partner. The association between marital status and suicide risk is a crucial consideration in the holistic care of patients with breast cancer, as it may inform targeted interventions and support services. Breast cancer is a leading cause of cancer-related distress, and survivors often experience anxiety, depression, and other mental health challenges that can increase the risk of suicide. Despite the growing recognition of the psychological burden of cancer, the relationship between marital status, a proxy for social support, and suicide risk in breast cancer patients has remained unclear. This knowledge gap is particularly concerning, given the established link between social isolation and adverse health outcomes, including mental health disorders and mortality. To address this gap, a comprehensive analysis of the association between marital status and suicide mortality in breast cancer patients was necessary, taking into account the complex interplay of socioeconomic, geographic, and clinical factors. This population-based cohort study utilized data from the Surveillance, Epidemiology, and End Results (SEER) program, encompassing over 825,000 adults diagnosed with primary breast cancer between 2000 and 2022. The study employed a robust methodology, including subdistribution inverse probability of treatment weighting (CPTW), to balance baseline characteristics and SIPTW-weighted fine-gray competing risk models to analyze suicide mortality, accounting for non-suicide deaths as competing events. The analysis also involved landmark, subgroup, interaction, and sensitivity analyses to validate the findings and explore potential effect modifiers. Marital status was categorized as married/partnered or unmarried/non-partnered, allowing for a nuanced examination of the association between social support and suicide risk. The study revealed that unmarried breast cancer patients had a significantly higher risk of suicide, with a subdistribution hazard ratio of 1.34, corresponding to a 95% confidence interval of 1.12 to 1.60. Notably, male sex and estrogen receptor-negative tumors were associated with an increased risk, whereas older age and non-white race were found to be protective factors. The findings were consistent across different analytical approaches, including Cox models, which yielded a hazard ratio of 1.45, and sensitivity analyses, which produced a subdistribution hazard ratio of 1.42. Landmark analyses demonstrated that the association between marital status and suicide risk persisted at 1, 3, and 5 years after diagnosis, underscoring the enduring impact of social support on mental health outcomes. The study's results have important implications for clinical practice, suggesting that breast cancer patients who are unmarried or without a partner may benefit from targeted interventions, such as counseling, support groups, and social work services, to mitigate their increased risk of suicide. These findings may also inform the development of guidelines and recommendations for the care of breast cancer survivors, emphasizing the need for a comprehensive approach that addresses not only physical health but also emotional and mental well-being. However, the study's results should be interpreted with caution, as the analysis relied on observational data and may be subject to residual confounding or biases, highlighting the need for further research to confirm and refine these findings. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.